Antibiotics, of course, antibiotics require a pipeline. And a lot of times in chronic infections, you have dense scar tissue that's been there for a long time, you have dead bone, and so there's really no pipeline to deliver the antibiotic to the site that you need it. And so in order to get the antibiotics going, you have to take away the dead infected tissue, the dead infected bone, back to healthy bleeding bone so that you can deliver antibiotics. Now, some people would argue that maybe you don't even need antibiotics because it's a surgical disease where you have bad scarred tissue that's not viable. You take that out, get healthy biology back, and then everything should heal. But I think most people would argue that peripheral antibiotics, adjuvant antibiotics, are very helpful to take care of the areas that are marginally viable, that may survive if you give them antibiotics, or they die if they don't. So I think antibiotics are part of the treatment of an infected non-union. In the case of an infected fracture, I think they're very vital because the tissues are still pretty reasonable. You get rid of the infection, the tissues are going to deliver the antibiotic because the tissues presumably are still in good health. They haven't had a chance to scar over and be kind of atrophic and not be biologically active. That gets into a host of other local antibiotic adjuvants where you deliver antibiotics right to the wound, which is critically important as well to help sterilize the defect. In addition to your surgical debridement where you take out all the bad humors, if you will, a local depot of antibiotics is often helpful to deliver a local high-dose antibiotic to really sterilize the area, which IV antibiotics take some time to do. You'd rather speed up the process by delivering a high-dose antibiotic right to the site of involvement.